Live video is starting. So good evening mga arthritis warriors, and this is Dr. Joff, and I hope you can hear me. I hope everyone is doing fine. So this is about Angelica Panganiban. So if you didn't know, she was diagnosed with avascular necrosis po. So, what is a vascular necrosis or AVN? We're going to talk about that tonight. Again, this is something that I learned from Rappler, that Angelica Panganiban disclosed that she is battling bone disease. And this is as of November 2023. The doctors had advised Angelica Panganiban, according to Rappler, that she should consider joint replacement surgery. And the actress wanted to pursue a more conservative approach. So, why joint replacement? It's very possible that she has severe arthritis already. So, arthritis can happen in very young individuals if they have a vascular necrosis. A vascular necrosis of the hips means that there is bone death, and when there is bone death, the hip bone or femur head deforms. So here is an x-ray of a very deformed hip. The ball and socket joint are no longer round, there's no longer any joint space, so that is an x-ray of severe arthritis. Compare it to the normal joint. On one side, you have a round head, joint space, a good round ball and socket joint. Again, here is a normal x-ray of the pelvis. Again, yung hip joint po is yung nasa singit po or sabugan in Visayan. It's actually yung singit or bugan, or in English, it's the groin area that you have pain. So this is an arthritic hip joint. The ball and socket joint are no longer round, very much deformed. So a lot of patients have asked me about AVN and arthritis, and here are some of the things that we tackled. What is happening is actually when the bone dies, it loses its shape, it deforms, and that is where arthritis occurs. Now, I already showed you what the normal x-ray looks like. Again, the hips are the groin area. The hips here in the normal x-ray are very round. They have joint space. The ball and socket look round compared with the abnormal ball and socket point. And this is a deformed head with severe arthritis. If Angelica has already severe arthritis, that means she has had these symptoms for some time now. It may mean that she's no longer in a mild or moderate type of AVN, but the more severe type, where she is already advised a total hip replacement, where in this type of surgery, the ball and socket portion of the hip are removed and changed with an artificial ball and an artificial socket po. So patients who get this hip replacement can get their quality of life back, and a lot of patients have been through this surgery in the States, in abroad. They're already doing outpatient total joint replacement. So if you are afraid that you can't walk, a lot of patients are already walking all around the world po. So how do we get AVN? How do we get a vascular necrosis? Anything that damages the blood supply to the hips can cause AVN or osteonecrosis. Steroid use is one, and one of the most common. Patients think that steroids give you stronger muscles, but it can cause bone death. Trauma to the hips, like a fracture, again can also cause AVN or a vascular necrosis po. Deep sea diving or the bends, they can cause AVN. Alcoholism decreases blood flow to the hip, and that can cause AVN as well. Smoking, as well as Metabolic diseases like diabetes and blood diseases, if you have certain cancers or blood disorders, can also cause AVN of the hip. So we don't really know which of these caused Angelica Panganiban's AVN, but she may have AVN sometime now because it's already at a stage that she was advised a hip replacement. So what are the symptoms and why is Angelica suffering so much? If you have the symptoms of AVN, the usual symptoms are again, sakit sa bugan, sakit po sa singit, groin pain in English, and this groin pain or sakit sa bugan o singit can radiate down the thigh and even parts of the knee. So yan po yung mga simptomas ng AVN. So again, the hips or the AVN, the hip part that we're talking is the ball and socket joint po. Hindi po exactly yung tinatawag na balakang, but yung singit po yung pinag-usapan natin. So it's really the groin. So don't overthink. It may not be AVN if you're having any groin pain. Please consult po your doctor. And please know that we have support groups all around the Philippines. Here on Facebook, we have the AVN or Avascular Necrosis Filipino support group in the Philippines. And we also have a dedicated chat group for the Young AVN Warriors Pinoy group. From Filipinos all over the world have tried to help each other to battle this AVN disease. So I hope this helps and I hope to see you soon po. Please share this for more awareness of AVN. Have a great night po. Good night.